Good evening and welcome to the call. I want to thank all individuals, organizations, and institutions that have helped to make this conference call a success. Because we have a lot of guests on the call tonight, we will skip the introductions of those organizations and we will give credit to the work they've done in the PDF that will go out to the community. Thank you. I have Chris Johnston, Communications Manager, Samaritan's Purse. They have been working on the front lines, as many of you may know by now. Scott Lane, the Executive Director of Global Health Ministries. They're a nonprofit organization based in Minnesota, and they have already shipped and air freighted thousands of dollars of medical supplies to Liberia. They've been very, very helpful so far in this fight against Ebola. We have Bestwa, that's BESTWA. They are also a nonprofit organization based in Dallas, and they've worked in Liberia for more than 10 years. Emphasis in sponsoring feeding programs in places like Bassa, Nimba, and other places outside of Monrovia. We've also reached out to Médecins Sans Frontières for this conference call, but we got response that their budget for Liberia has already been fully funded, and so they're no longer receiving Liberia-specific donations, although they would like everyone to know that they're still receiving donations into their emergency relief fund. We will also have a Liberian Red Cross representative who should be able to join us for this call as well to give us a needs assessment from the Red Cross's perspective. Lastly, we have Dr. Musaka Fallah, an epidemiologist who is currently in Liberia helping the fight against Ebola. If you're by your computer and you need to send any questions, the email address is libstopebola@gmail.com. We have lots of people on the line, so it will be very difficult trying to manage everybody asking questions. So if you need to send a question in, again, it's libstopebola@gmail.com. I will now turn it over to Chris from Samaritan's Purse.
One of our physicians was infected with the disease, but we're very thankful that God has spared his life. He was recently released, and he has been declared Ebola-free. So we're grateful for that, and he does plan to return to Liberia at some point. We also, so at that point, just for concern of our staff, we had temporarily suspended the clinical treatment, but we plan to return to that as early as sometime in September or possibly later this fall. We continue an awareness campaign, and through the end of the year, our goal is to reach 700,000 people in Montresota County, and that work is well underway now. We've got about 350 people working every day, just getting those messages out, using posters, using community meetings to help get the word out. And so that's a big push for our organization, as well as we plan to return to clinical treatment later this fall. And further, we continue with logistical support for those 2 case management centers, one in Foya and the other in Monrovia. And that entails shipping the personal protective equipment that's needed, as well as chlorine, cleaning supplies, those types of things to protect those physicians and medical workers who are actually in the isolation units, as well as those attending patients who are in maybe a waiting area as they await the results if they're suspected to be positive of Ebola. So those are the primary things that are going on with Samaritan's Purse right now, and really the most effective way to partner with us at this point is through financial donations, because the World Health Organization has identified some specific personal protective equipment, PPE, that they want workers to be using in those isolation units. And in order to obtain that, we're able to buy that in bulk. We're shipping about 3 or 4 shipments a week, keeping those supplied so that those 2 case management centers are well supplied. And So a financial gift allows us to purchase that and to ship it, and also with the awareness campaign, our staff who are out there every day, just in the streets, helping to educate people, giving out literature, putting up posters, those types of things. That's what financial support allows us to do. And further, this is a smaller aspect. Well, it's maybe not as applicable depending on your connections and networks, but there are some items that we're able to accept in terms of a gifting kind, and I'd be glad to follow up with someone separately offline if that's of interest. If there's maybe connected in with a hospital or a supplier who could in bulk help with some of that personal protective equipment, then we would be glad to discuss, what specifically those items are and what quantities. And
could you work with people in different states, or are you limited to specific states?
Yeah, we work across the country, even globally. I think you mentioned some of the people even in the UK. I'd be glad to have conversations and about connecting, and so yes, we're glad to connect and work with whoever is wanting to help in this work.
Okay, great. Thank you, Chris. The purpose, again, of this call is to connect stakeholders. So if you have need, if you need to reach Chris, for example, the contact information to the address I just mentioned, and then we can connect you with Chris, so you don't have to go through all the steps that we went through to get hold of Chris, so we can connect you directly. So again, the address for questions and for connections would be LIBSTOP Ebola@gmail.com. What we've also seen here in the war against Ebola is the other aspect of nutrition that we've heard reports that people aren't being fed. We're trying to bring in as many stakeholders as possible. And our call to Liberians across the country and the world, as a matter of fact, is we can all knock on doors. Some of us may work at hospitals. Some of us may work in areas where we have connections with people who would be willing to donate food and other supplies, and then connect them with groups like Global Health Ministries, groups like BESWA, Samaritan's Purse, and all these organizations that are actually out there in the fight against Ebola. Let's speak with Andy Perkins. Andy is the chairman of the board of BESWA, and they're based in Dallas, Texas.
Thank you. We at BESTWA have been working in Liberia since 1998. We have experience with something similar to this in that we worked throughout the war, or the second iteration of the war. And right now we have 3 containers on the way to Liberia. We work primarily in Granbassa, Nimba, and Riversest counties. So we're not in Monrovia. We're in areas outside Monrovia. And presently we have containers in New Jersey, Murfreesboro, Tennessee, one in Houston, and one in Beaverton, Oregon, that are being loaded with personal protective equipment, and another 2 containers with manna meals, food. Those will be shipped shortly, and donations that you send in would be used for that effort. So the way that you get to the specific donations that we're talking about is go to www.bestwa.org, bestwa.org, and there you will see a page called Liberian Ebola Crisis on the right-hand side. And under that page, you will find We Stand as One. And from there, you can make a donation where it will specifically go to the account We Stand as One Against Ebola. And we thank Mr. Sua for the effort that he's done to put all this together, to work with such organizations as Samaritan's Purse, that an organization we look up to and attempt to emulate. But you can also, through Mr. Sua, contact me directly. I'll help you in any way that I possibly can. And we just want to work together to do the best we can to help our brothers and sisters in Liberia in this time of crisis. Thank you.
I do have a question here. Someone just emailed one, Frank Williams, from, I think it says Southwest United States, so I don't know where that is. But he's asking you, Chris, if Samaritan Purse could work with Ebola-related supplies delivery to Liberia. So I don't know if you answered that earlier, but is it possible for you to work with people in the Southwest?
The question is working with people to get supplies to Liberia. I believe right now we do have a container, but it's set to leave probably within the next 8 to 10 days. So that being the case, most of what we're doing, we're buying direct from companies and then shipping. So it's not actually coming through our warehouses in Boone. So that being the case, we don't expect to be sending out a lot of other full containers, sea containers. But yeah, if you want, Philip, it's glad to connect offline to discuss kind of on a case-by-case basis. For the most part, we're not doing that, but there may be some additional containers going forward.
Okay, and then Andy, and is it something that you can connect with as far as delivery, or even Scott Lane, Global Health Ministries?
Yeah, this is Andy. If you will give me a call or email me, it'd be best to email me, Andy, ANDY, @bestwa.org. We'll do our best to connect you up with the closest container to you that we're preparing for Liberia.
And again, the whole idea is that when you do collaborate, we need that information back so we can get, and one is transparency, but, we can get that information to all the Liberian organizations whose members are on the call to know that this effort is something that's generating some degree of results. So that's what the only thing we ask, just shoot us an email that you've worked with this person and this is what transpired, and then we should be good. Okay, I have another question from someone, Neil Carey. I'm an American trained MD, licensed in California. I want to volunteer time working for Ebola patients in Liberia. Is that something the Samaritan's Purse is interested in, as far as doctors who are willing to go to Liberia and volunteer to work?
Yes, we have been using volunteers, mainly volunteer physicians, nurses, those with some type of medical training, and and I'd be glad to talk with someone, connect with them directly to discuss those opportunities, which we expect to open up again this fall.
Awesome, thank you. So I'll go ahead and make that connection. I'll follow the email, and then you guys can connect. And again, I don't have to be involved in whatever transpires as far as the details, but I would appreciate some kind of an email back as far as the results of what transpired. Andy, how you mentioned a few ports that you work out of. How does that work if Liberian organizations in different parts of the country or in or around where your port city is? How does that work? Do you pick up the supplies if they have them, or do they have to deliver the supplies to your warehouse?
Yes, what we do is we ask that the donors ship the supplies to the warehouse that's closest to them, and we give them the information for that. We're not equipped to go around the country picking things up, but depending on how big the donation is, they could send them by UPS or by on a skid, shipping to the nearest warehouse, and hopefully we'll save them, money by getting it to the warehouse that's closest.
All right, thank you. I have another question here from one. We got Dennis and Karen Fisher out of Philadelphia. This is we're a small nonprofit, which is also a registered NGO on the grounds in Liberia, responsible for supporting to mission schools. Their question: our budget for sending supplies is limited, but we have a good network of volunteers and educators with some transportation and communication abilities. what are the best ways we can assist? I guess, Scott, you have any comments?
Yeah, so the first thought is that if she has access to supplies or has a donor that has approached them and said, I have these supplies, gloves, hand sanitizer, gowns, PPE-related items, then I would ask the question, where is it located? And if they're on the East Coast, I would have them call Samaritans First. If they are in the Midwest, then it would be close to Global Health Ministries. So I would ask the question logistically, where are they within the country? How much do they have? And then find that organization that would be closest that is shipping to Liberia and have them partner with them. And that's what I have been doing when people call. We've had people from Virginia, Georgia, Florida, and I have been saying, you're in the East Coast, call Samaritans First. Have them, you should partner with them in that regard. If they're in the Midwest, then I've been encouraging them to bring the supplies to us here in Minneapolis. Thank you.
I have another comment from Verlon Stone, and I guess it segues, your comment segues into what he's suggesting. He's in Indiana, and he's suggesting that we have a clearinghouse for all the work that folks are doing in different organizations, so that we can report into that clearinghouse. We can all have access to it. We can view what's going on, and it's also a good point to connect. Like now, I'm receiving a lot of emails on folks who want to work with BESWA or Samaritans First or Global Health Ministries. So that's the whole purpose of having that central database of connecting all the stakeholders. I have another question here from, let's see, another NGO. Unfortunately, I can't mention group names that we haven't vetted. I apologize, but I can't do that. We're only connecting folks who have been vetted, so that we have some sense of trust, and that we built relationships with these people, and they've demonstrated their work over the past few years. And that's the whole purpose of this call, because I'm receiving a lot of emails now from different NGOs who are asking us to plug them in on the call. So I apologize, I can't do it. We are restricted to the people who are on this call and those who that we have vetted. So we can discuss offline some of your comments that you're emailing me as we speak. All right, Scott, while I'm doing this, do you have any other comments you can give us as far as how folks can work with Global Health Ministries, please?
Yeah, so again, this is Scott Lean from Global Health Ministries, and we've been involved with Liberia for almost 27 years, since the beginning of our ministry. And our ministry is focused on supporting the Lutheran Church in Liberia. That is our partner. And within the Lutheran Church in Liberia, there's been traditionally Phoebe Hospital in Banga and Kern Lutheran Hospital in Zorzor up in Lofa County. So we've been supporting these two hospitals for, again, almost 27 years, shipping regular containers there, and even during the war years, providing funds for projects. And so when the crisis broke, we received a call from Dr. Walter Gwenegali asking for support, and our traditional support has been sending sea containers every 6 months or so with supplies requested by Phoebe and Kern, and including supplies for other partners, lately for Gonta and for JFK, Elwa, for the Catholic Hospital. We gathered PPE items that Dr. Gwenegali had identified, and Dr. Paul Mertens, who is with us as a consultant, built these 5 pallets, and then our freight forwarder, Stevens International, they arranged for the air freight to go from Minneapolis to Monrovia through Air Canada and Brussels. And that took 5 to 7 business days. It was like $8,150, so expensive. It was consigned to the LCL. It arrived. We included items for Phoebe, Kern, and the Ministry of Health. The DuPont hazmat suits and goggles and gowns and gloves. And so we felt good about the arrival of that. While we were doing that, we loaded a 40-foot container and filled the same stuff, gowns and gloves and and I don't know, Samaritans First, how you guys have how you're doing your air freight, but I'd love to learn how you're doing that, and if we could send you the product, you guys could ship it there, or we could just call your freight forward and they could pick it up from our warehouse and ship it. But for me, I want to hear more of that collaboration on the freight, the logistics. We have a lot of Liberians in the Minneapolis, the Twin Cities area. They are on fire, collecting supplies, bringing hand sanitizer and gloves, and the response has been beautiful, but we just need to get this product there now. And not only in Monrovia, but how do you make sure it gets distributed to the schools, the churches, the health centers, the rural clinics? Get it out of Monrovia and get it in use by people. So that's where global health is at, where we're looking for partnerships. We have a designated account for Liberia shipping since the beginning of our organization. So we pride ourselves on 100% designated for Liberia shipping, and we are very transparent. We print out reports and tell you exactly who's contributing, how much funds we've received and the in-kind. So we're a very transparent, open organization. And so if you have any questions, shoot me an email or let me know. I hope this is helpful.
I think I do have the doctor on the line from Liberia now. Musaka, are you on?
Yes, sir, I'm on.
Okay, great. Just give me a few seconds. So one of the things, for those who are emailing questions, I will connect you to all these different groups. We'll send that information out in PDF form to your email. So I'm getting a lot of questions, folks not getting the phone number or the email addresses clearly. So don't worry, I'll give you the information in PDF once you email LIBSTOP Ebola@gmail.com. LIBSTOP Ebola@gmail.com. So I welcome Dr. Musaka Fallah. Again, he's working in Liberia, and he will tell you more about himself. Go ahead, Musaka.
Okay. Thanks, sir. Welcome. So basically, I'm working with Ebola response, more or less from a public health perspective, trying to break the transmission of the disease.
Now, Musaka, can you give us a background? I'm also getting a lot of questions on who you work for. Give us a little background about yourself, who you work for, and how you play a role. I keep getting tons of questions on that.
So I'm a consultant. I've been hired by ACF Action Control La Femme as the program manager for Ebola response. Prior to that, I came out to Liberia in January 2013 on a USAID project to begin a program for public health. By training, I have 2 masters. I have a PhD in immunology and microbiology from the University of Kentucky. And then I went to Harvard. I have a master's in infectious disease epidemiology. And so I came back to Liberia to run a public health program for USAID. And the program was just running up when Ebola started. I was about to go back to the States and Ebola started, and I decided to get involved. And I've been helping the county to strengthen the county in the Ebola response. Then I got hired by ACF. Do some part-time work for WHO. I've been working for WHO in and out, and so I closely collaborate with WHO on the transmission cycle of the disease, trying to track cases. So that's a little bit of my background. I spent 10 years in the U.S. I just came back January last year, and then I was here as an epidemiologist by training. I'm working on this whole Ebola response, if that answers the question. And I guess most of you guys have read, have some knowledge about Ebola. Historically, there are 2 ways you can basically break the transmission. One of those is to be able to, those who become sick, to get them from the population, or if someone dies from an Ebola case, while it's a suspected case, to be able to quickly bury the dead. In both of those instances, what you're trying to do is to remove the virus among the population. Failure to do that, you just propagate transmission. I hate to say, but these are 2 areas that we haven't done a very great job. And in as much as we cannot succeed in our ability to withdraw the sick from the population or to be able to quickly bury the dead, we have a long battle to go. For instance, there are reported cases where someone dies from Ebola or suspected cases, and the body stays with the family for 3 to 4 days. And people tend to get in, the dead body is more infectious. There are instances where someone gets sick and they stay 2-3 days before we can take them to the treatment center. During that interval, the person has a propensity to spread the disease. And so we see this wild spread of the disease that we have not been able to halt. I've tried to do some investigation to look at the system and see what part of the system is not working effectively so that we can do our job. For instance, I was just reviewing some of the statistics. There are 75 calls from the community for cases, but we're only able to respond to 22 of those calls. So essentially, we are not responding adequately to all of the calls. And our response time is so long. And so the critical factor that we need to break the transmission is still a weakness. On further investigation, I realized that, for instance, most of the vehicles that need to leave in the morning to go for the sick or bury the dead don't leave early because they have to wait 3-4 hours before they can receive gasoline for the day. Those are system problems. No amount of logistics can solve that problem. We must be able to develop a system that a vehicle will get fuel adequately and be able to move where there are sick people or where the dead are. But if we stay working on the issue of logistics and the vehicle has to stay 3-4 hours before they can move into the field, for instance, the burial team has to be out by 6 p.m. Well, if they have to leave the compound by 1 a.m. and go in the field to work, and just for them to get dressed to remove a body takes about an hour, and then they leave the ministry by 12 or 1 o'clock. So essentially, only have 2 hours to work or 3 hours. How many bodies can they remove from the community? Or the case investigation team that has to go to investigate a case, if they get delayed because they don't have fuel or gasoline on time, it becomes a problem. These are not logistic issues. These are system issues that we need to handle and work. Some of you guys in the U.S. sometimes we need to come and take all these real problems and see how we can troubleshoot this system problem and solve them. I mean, I was surprised to know yesterday there were so many sick people and beginning to call. We couldn't move them back into the treatment units because all the treatment units were filled last night. So do we want to control a larger treatment unit for 1,500 people? The key thing I'm trying to say to you guys is that fundamentally, we don't have here a unified, synchronized system. In between our system is broken that need to be unified, that need to function smoothly. We need to increase our response. We need to be able to shorten our response time to be able to identify sick people in the population and remove them quickly. In our inability to do these two things, we hamper our response to Ebola. For instance, another thing I see on human resources. For example, one of our drivers could not come to work today. And I want to investigate why is he not coming to work and we got to be in the field 7 days a week. He said, I've been working for the past week. I don't know my status. I don't know how much I'm going to be paid. People sign contract. People are made to work. They don't know their contract. They don't know how much they are going to be paid. And these guys become demotivated. So we got to build an overall system. We need to have a smooth system. Like I always say to you guys, we have to approach this like a war. Liberia is at war with an unseen enemy. We have to see like that and approach it every day. But we are making the same mistake and we're having the same meetings over and again, and we're having the same challenges every day. Meanwhile, we don't have the luxury of time. Every day that passes, the disease increases exponentially. More people get infected, and more people die. So I know we're working on the logistics, but we can look at the system itself. Be able to repair it so that the system can respond in a unified manner. That is what is the frustration part for me as a person who is on the ground in the trenches. That's exactly my point. I think it's a system issue. For instance, on the issue of fuel and gasoline, can we not be able to get gas car or gas slip and give it to drivers so they can fuel the thing every evening? Can we not be able to provide enough body bags for Red Cross for 1 week that we have to do on an everyday basis? There are major bottlenecks that we are not able to find solutions, and these are hampering our responses. I probably want to stop now and probably take questions if I'm not talking too fast.
No, you're doing very well. You actually have tons of questions that are just pouring in. I want to one of the questions come from Maryland, and they're asking, as best as you know, are we burying or cremating the bodies, and how many burial teams do we have? That's Beaumont in Maryland.
We started with 2 burial teams. We went to 4 burial teams. Now we have around 6 burial teams. Even the 6th burial team, we're having challenges. Now you want to bury all the bodies. I mean, these are records that I have. I know yesterday, for instance, there were 6 bodies in Yucatan. There were bodies in Bensonville. There was a body in Slipway. And we couldn't get all the bodies around. So we have 16, and we went from 2 to 4 to 6. Yet and still, we're still having bodies in the community. So don't you think it's a system problem? We want to ask ourselves, what is going on? Why are we not able to bury all of the dead? Why are the dead staying 2 to 3 days in spite of the fact that we're going from 2 teams to 16 now? These are issues that we have to ask ourselves. Troubleshoot the system and we know what is happening.
Okay. So thank you. So I think some of the questions for us on the call, as far as those who are wanting to help the different organizations, it gives us an opportunity to target some of the resources. I know some Liberian organizations have been raising funds, and so these are some of the areas that we can connect. Hopefully, do a little bit more research on who to connect these organizations with in Liberia to help with some of the issues that the doctor is mentioning. Again, this is Dr. Musaka from Monrovia. He's been working with Ebola patients out in the field, and it's very sad that some of the news that we're getting. But I guess we need to hear the information to get up and try to support the effort of stamping this disease out. We cannot limit ourselves to mentioning the problem, and that's the purpose of this call. Let's get the stakeholders on. We have Global Health Ministries that are sending supplies. We have BESWA that specializes in nutrition, because I've heard also that nutrition is an issue in some of these Ebola centers. We have some of the other institutions, Samaritan First on the line, and they can also help. So my suggestion, as the questions are coming in, email us if you need to get in contact with some of these humanitarian groups, so that they in turn can transfer some of these supplies to Liberia. I've received a lot of questions from different groups asking how they can be vetted to be recommended to the group or to Liberians. That's something we will have to take offline and try to get some information on these organizations before we include them. Because one of the things we do not want is for us to recommend to Liberians and, recommend organizations to Liberians that are not credible, that haven't been doing work in the country. We don't want to recommend organizations that just pop up because of Ebola. There's nothing wrong with that, but that's not what we want to do. Our purpose is to connect Liberians with established organizations. It doesn't mean if you're not connected, it doesn't mean you're not credible. It just means that we have a criteria before bringing folks on this call. And so I apologize again. I'm going to take most of your questions offline when it comes to the organizational issues of getting on this call and recommending things to people. I have a question here from one Dr. Conde Greaves. I don't know where he's emailing from, but he asks, is it possible to airlift supplies by any of the NGOs on the call if we send them monetary donations nationwide? We have 10 pallets plus supplies we'd like to send now and airlift. So I guess, Dr. Conde, I'll connect you with some of these organizations that will be more than willing to work with you. I will just do the email connections here later. So Musaka, one question for you also, as far as the spread of Ebola at the treatment centers, what are some of the needs? Where do you think Liberians here can fit in to close some of the gaps that you're seeing out there in the field at the treatment centers?
Okay. The treatment center is more specialized. I mean, you need experts. I saw MSF trying to ask for 50 doctors who have had experience in Ebola or Marburg disease, hygienists, and, those are more specialized treatment. I mean, like MSF, one of the meetings we're seeing, they can scale up to maybe 200 beds or 300 beds, but they will need people who have our experience. But having doctors, but that's one area. But another major area we need is if we can find Liberians who are sociologists, counselors, psychologists. The only way we can break this transmission is to get our communities involved, mobilizing our communities, organizing our communities. So a lot of community work is needed. I mean, if we can get people working at the level of the community, putting community leaders together, empowering them, because if you read the story of Ebola, whenever it has gotten, the transmission has been broken, it has come from the community. If the community leaders come together and they are on active surveillance, they're finding cases on time and reporting cases, and being able to detect cases on time. Even like in Lofa, the situation in Lofa has been reversed because the community has taken leadership. So one area that we can provide a lot of support is empowering the local communities, helping them to be able to come together as a group, whether it's in logistics, it's in food, to help the people who are going through the affected. Another area I see is the area of human resources. We need to find ways to be able to help the guy in the field, whether the drawer, the sprayer, to see who can help them. And just the issue of fuel, ensuring that our vehicles run on time. If an organization like Brock can say, okay, I will take care of the logistics, ensuring that there is adequate fuel for the vehicles to run on time. Those will be issues. I mean, at the treatment center, in most specialized, you need your PPEs, you need more chlorine, and a symptomatic treatment, which I won't comment more on. I mean, the other guys are here with MSF. I'm more on the infectious disease side, the disease transmission side. But just getting more people in the field to be able to identify the disease, helping us to raise more vehicles that are operational, that don't have to break down because of lack of fuel, and the human resources. If we can produce a lot of human resources and work with our community leaders, I mean, some of you guys in the U.S. who have idea in organizing community, coming to work with our community leaders, organizing them, and once they can come together, they can be able to identify the disease on time. We can break the transmission cycle. Because the issue is, and those of you that will know social media and mobilization, creating awareness. I was in West Point yesterday. Some places when people were jeering at me, they were laughing at us, saying they know Ebola. Ebola does not exist. I was so shocked when, in fact, we counted 39 persons that died in 30 days. And yet, instead, people were laughing at us. And we're trying to go from home to home. So, awareness creation, helping the people to see, working through their leaders to see that that Ebola is real, it's a threat. It's going to help us a lot. Just those things, working in the community, helping to get vehicles, investing in human resources, investing in our communities, creating massive awareness at a personal level, one-to-one level is going to help us a lot. That's my own take again, maybe because of my own inclination towards public health, and I work more towards transmission in the treatment unit. That would be my own take, that investing in human resources, in fuel, in vehicles, that will have enough vehicles to respond, to move the sick, to remove the dead. Those are going to be critical things that will stop this transmission.
All right. Thank you, Doc. I have a question here from, a few questions coming about doctors. I think we've answered that. If you're a doctor or if you have nurses and you want to work in Liberia, we will connect you to Samaritan Purse later, either by email or contact information. And then you and Samaritan Purse can do the connections from there going forth. I think Chris has already mentioned that, so there's no need to ask that question again. Now this question goes to both Chris, Scott, and Andy. Someone is asking if they have pallets or donation of supplies specific for, say, a part of Liberia. So, say I want to donate to Barnesville, I want to donate to Lofa or Bon County. Will that supply, is it possible for you to manage that supply to Bon County, or are you just going to drop it in Monrovia or to groups in Monrovia? Scott, you go first.
Okay, so this is Scott. So we have had some requests for items to be specifically designated for Phoebe Hospital or Kern Hospital or JFK or Donta. And so for Global Health Ministries, our focus historically has been Phoebe and Kern. We have now included items for the Ministry of Health And within the Ministry of Health, we've included items specifically for JFK or ELWA. So we have done that. We will continue to do that. It's just that the containers for global health, our shipments were consigned. We consigned them to the Lutheran Church in Liberia. It's under their name that it's cleared. And then those shipments go from Monrovia up to Phoebe in Banga, and it's there that it's distributed. And so I would just be concerned about the logistics. As it arrives in Phoebe, where is it going? And Ganta is close, and Nimba. But, I mean, if it's on the other end of the country, it might be better to send it with someone else who's sending or shipping in that direction. But for Bong County, Lofa County, that's where we have been traditionally shipping to and will continue shipping.
All right. Thank you, Scott. I have a question from Dr. Peter Politin. I'm sorry, I hope I didn't butcher your name. It says, I know also Liberia, having worked there as a Peace Corps physician in the past. I'm there working with various, if you can, please make contact. Okay, well, I'm sorry. They're asking for connections. I will connect you after the call. Again, the doctor on the call, I'm getting a lot of questions. His name is Dr. Mosaka. It's Mosoka. Last name is Fallah. He's speaking from Liberia regarding some of the issues he's seen with the Ebola response. So let's see. I have a question here about air freight, and then I'll get back to you, Doctor. And that question, Global Health Ministries, are there any efforts as far as the connecting with some of the major airlines or these carriers, UPS, Shell, FedEx, that Liberians could donate supplies to? Is it something that Global Health is working on as far as delivery of supplies to Liberia?
Yes. So through our freight forwarder, Stevens International, out of Columbia City, Indiana, they were able to help us connect with Air Canada and Brussels and arrange for the air freight shipment that we have that has already been already received, and on our second air freight shipment as well. And I believe that's going out through Air Canada and Brussels. But the challenge is that it's not a direct route. It's taking 5 to 7 days. The cost for 5 pallets is about $8,150, $8,500, around there. So I've not been able to find a less expensive route, more direct route, and the route has been like Minneapolis to Chicago, Chicago to Toronto, Toronto to Montreal, Montreal to Brussels, Brussels to Monrovia. So not the most direct. And we're certainly not experts at the air freight option. We're the slow boat organization, but if anyone can help me find a better way to do the air freight, I would love to do that, and we can partner together. But that's what we have explored and found so far, and I've not been successful finding other ways.
Okay. Thank you. I'm also getting quite a few number of questions. I guess all the minds, I think, is similarly. A couple of the questions, are we tracking donations? So, again, these organizations are independent, and that's the reason why we're making sure that they're organizations that have track record, and that's why we brought them on the call. I personally don't have any means of tracking donations because I don't have anything to do with donations. What I'm asking these organizations is to plug us in as far as information. So if Global Health Ministry is receiving, if you're giving funds to Global Health Ministry, just email us at libstopebola@gmail.com and just give us heads up that, hey, I donated a pallet of nutrition to Global Health Ministries. So if you're making donations to any of these agencies, again, just inform us at libstopebola@gmail.com. I'm also getting quite a few number of questions that I'm not refusing to ask them, but some of the guests are not in a position to ask them, to answer them as far as, what is the government doing and some other questions that they may not be in a position to answer because they don't represent the government. And the doctor is speaking from basically a medical perspective and a human health perspective. So if you didn't hear your question pertaining to that, then that's the reason why I haven't asked those questions. I have a question here, Dr. Musaka, if you are aware of crisis management team, and then how do we track the mortality rate between Ebola and malaria? Because we're hearing stories that people are dying of malaria, cholera, and dying of diseases that have some of the same symptoms as Ebola. So how are we tracking it too?
Yeah. Right now, I'll be honest with you. I mean, all of us have made an error, even myself. I think we have all our attention focused on Ebola. And a couple of factors have led to that too. And that has led to the fact that we ignore common killers like malaria, diarrhea, pneumonia in children. I read a couple of times where even pregnant women can get treated. But one of the factors that drives that is that the fact, if you know that in this Ebola crisis, Liberia has lost a lot of healthcare workers. And, and that has led to a lot of fear among healthcare workers to test people who are sick. So there are tools we can do. One of the things we can do on your end in the U.S. is to ensure that we provide a lot of PPE and protective material for healthcare workers. Some of them want to go back to work, but they are afraid. They've seen a lot of their colleagues die, especially in the case of malaria. I'll give you an example of a case that I've been involved with. This guy treated someone, what we call a rapid diagnosis test. He did it. He pricked the person's finger. He never had on glove for malaria test. He did a malaria test, and this teaching assistant died. His wife died. 3 other persons died. And so there's this widespread fear now. In the absence of adequate gloves, adequate PPE for nurses, they are afraid to go back to the hospitals. So that's one way we can help to address that issue. If we can have enough PPE, enough barrier nursing like masks and gloves and an apron for our healthcare workers so they can protect themselves, it's going to help the case, but that's a fact. The second thing is that people are beginning to ask a very serious question. Do we want to not treat our malaria by using blood, and we know blood is very infectious? People are now suggesting that we try to treat malaria symptomatically. Then, you treat your malaria symptomatically. So that's the second way we can approach this issue. But it comes down to one thing, supplying enough material to the healthcare workers so they are protected. They can wear the long gloves, they can wear their gowns, disposable gowns, they can have enough gloves available. And so it protects them from, just in case there is an Ebola patient that slipped through the crack, they can protect themselves. We got to do that. By doing that, we reassure their confidence because many of them have died. The second thing we can do is have people on the spot to be able to help them to ensure that they are properly getting dressed. And then, as I said earlier, they can treat malaria symptomatically. They don't have to go and prick the finger for blood. And, those are the kind of things. But it comes down to us helping them with enough logistics, enough barrier nursing, enough gloves, enough PPE. That will help a lot. But that's a serious case, and we are making a little bit of mistake. I know that the government is responding gradually to reopen hospitals. Redemption is open, and other clinics are open. But we need a lot of material for healthcare workers. And they need assurance. They need to be assured because many of the healthcare workers have died. I don't know if I answered your question, but it's an error on our part. But we are responding to the Ebola crisis, and because a lot of healthcare workers die. But I'm sure if they have enough protective gear, we can supply them with enough protective gear and gradually encourage them to go back to the health centers. But indeed, that's a fact. We're doing very less now on malaria.
Thank you. Again, you're on the conference call with Global Health Ministries, Bestwa, Samaritan First, and we do have a doctor from Liberia who is currently speaking, Dr. Musaka Fallah. We should have gotten the Liberian Red Cross on the phone, but we've had difficulties getting them to speak and give us a needs assessment of what's going on in Liberia. I'm also continuing to get a lot of questions specific to the government of Liberia. I can't ask those questions. The folks on the call are not political, and they don't have access to information as far as why the government isn't doing X, Y, and Z. So I apologize. I would appreciate some of those questions, and I'll respond to them later. But I'd appreciate if the questions can be restricted to what we can do to provide supplies the best way possible, and how can we understand what is really going on. That was the whole purpose of having the doctor on the call. and how can we connect with some of these trusted organizations that can actually get the supplies to Liberia. As far as Ebola supplies, we have a lot of organizations sending gloves. Outside of gloves, I mean, what are other things that, maybe you know of that's not really getting to Liberia? Thermometers. I mean, are there anything else that outside of gloves? Because we keep hearing gloves, and I'm sure glove is not the only PPE that we need to fight against this deadly virus. So is there anything else that Liberian organizations can pick up on and try to run with as far as providing supplies?
Yeah, okay, yes, indeed. You talk about thermometers. Initially, we're using these ordinary glass thermometers to determine temperature in following up patients and what we call contacts. Very soon, we found out that there were variations in temperature. So what has happened now is that there are these laser thermometers that use a laser light, and there are a few of them in the country. I mean, if people can lay hands on those ones, they will help a lot. I mean, it's not invasive. You don't have to come in close contact, and you get pointed and can tell the temperature. They are now using at the airport and a few offices. And very sure if we get a couple of those to place them in hospitals, among our field workers will help a lot. I think they are laser thermometers. Just stand out and point, like a light, you point it and tell the temperature. That's one thing we could really use. And then what that does for us is it keeps you away from direct contact. As you know, Ebola is a disease of direct contact. That's one. And obviously, gloves are not the only PPE. We're talking about aprons. Yeah, and some plastic aprons, disposable gowns. You have the hair gear, and you have the surgical masks. Those are key things, surgical masks. You want the cap, and then a disposable gown, aprons, rain boots, and, some of the rain boot cover. Those will be critical things for the nurses to wear and the healthcare workers to wear while in the hospital. And I'm sure when they have this kind of protected gear, it will reduce the fear, and it will allow them to start looking at patients and evaluating them to triage them to know whether it is Ebola or is non-Ebola disease that need to be treated, because these other diseases can also kill as well. Also, I know the record is not here, so I wouldn't want to speak about them for them a lot. But I know one point in time there were challenges with body bags. So if we have some body bags, chlorine, we need a lot of chlorine. We use a lot of chlorine, even not only for the ministry, not only for the burial team, but at all levels, even in the communities, there's a high demand for chlorine. We need it a lot because people use the wash hands in the community, in the hospitals, to disinfect bodies, to disinfect homes. So there's a lot of need for chlorine. These are the critical things that we really need, even to help our hospitals to get them back on their feet, to help our healthcare workers.
One more question for Dr. Musaka. Why is it that a lot of people aren't believing the fact that Ebola exists? What can be done is from a communications point of view to help close that gap?
Well, one thing for sure, I mean, there's anthropologists who follow Ebola in Uganda and other countries. When I read that, I realized it's not unique to Liberia, that whenever there has been an Ebola outbreak, it starts with unbelief, disbelief, and then as a reality sinks in, it shifts. Some people start to believe. So about 1 month ago, the unbelief and disbelief was large. Today it's shifting. Now some communities used to know who did not believe. That did not believe, now they are believing and they are responding. We still have pockets of resistance. Some people still don't believe. They are challenging it, and I think the way we can do it to make them to believe is a lot of awareness. And some of you guys in the diaspora to call them and give them some of the facts will help a lot, work through the influential leaders. And also I've been encouraging a lot of my colleagues. I said one of the things we can really do is to give them the lab results, because some of them will say their relative died, but they don't think it's Ebola. And so I'm very encouraging a lot of people. I've written a communication encouraging for a lot of lab results to go back to the community members so they can see the results and begin to know the level of Ebola in their community, sort of convinces them. So we need a lot more awareness. MSF is now working into various communities to create massive awareness. There's a project now with WHO to go into communities to work with leaders. So I think it has shifted a bit. I can be honest with you. The unbelief we had about 3 weeks ago has changed. Nowadays, many of them are calling us. Actually, many nights our phones ring all night. Some people are calling, and some of them are even driving them to the treatment center now. There's a guy who walked from Fairmount to JFK one whole day, but he was at the treatment center. So the perception is changing around. There are still pockets of resistance that we need to work a little bit harder. But again, I'm not being political. I'm not pointing fingers. But we have system issues that we have to have our response time to work faster. That's a little bit of a weakness on our part. I'm not going to pick and choose. What we need to do is to be able to respond fast. If the community comes together and identify a case and they call us, we need to get there within the next maybe 2 hours, 3 hours, and respond as fast and be present. If even we rule it out, it's okay. But that's one of the weaknesses I see on our part. We need to have to respond faster, and we are not responding as fast as we need to when they call us. And then the community comes from trusting to distrust, to anger, to frustration, and also as much as possible to try to get lab results back, for the dead and those who are sick. Let the community be aware of the lab result. And once they know a couple of times that it is Ebola positive, it's sort of help them to think. So it's a both-sided thing, yeah. We got to work on our response time. We got to give them feedback on the lab result. Whenever there's a lab result, to give them feedback. And most importantly, I want to encourage you all in the diaspora, we need to work with community leaders. Our parents and our family, we need to call them. Once the community comes together, become more active, and they're able to report strange death, strange movement in our community, it makes our work a little bit easier. I hope I answered your question. Yeah.
Yeah, thank you. We are just about there to wrap up. For those of you who have expressed through your questions, lots of them, how to contact some of these organizations, I promise I will make the information available to you. Some of you have expressed things that you're doing or wanting to do to get the Samaritans First or some of the other organizations on the call. I will connect you afterwards so that, again, these organizations can work with you in the Liberian community. All we ask is you email libstopebola@gmail.com with whatever you are donating to these organizations so we can, at least for now, have a temporary clearinghouse to track donations. As I stated on the top of the call, we want to make sure that everything that's donated goes to the folks that need them. And that's the reason why we don't have a lot of NGOs on the call. We have a few that we've asked around and we've done some legwork to verify that they're reputable and that they can get the resources to Liberia in an efficient manner. Again, we have Global Health Ministries. They've been doing this, like Scott had mentioned, I think he said 37 years. We have Beswa on the call, and they've been working in Liberia since 1998 doing work outside of Monrovia. We have Samaritans First, who we all know have been in Liberia working. Again, one of our guests could not get on the call. It's the Liberian Red Cross. He tried getting on, but for some reason had difficulty with speaking, so I apologize. But we have lots and lots of information. And we're going to do this call again. We're going to try to put this on some periodic basis so that Dr. Musaka can come on and give us updates. And then also some of these relief organizations can give us updates on what they're doing. First off, when the thermometer we're looking at is infrared thermometers. And if you have them or if you have access to them, we're asking Liberians to go out to different hospitals and healthcare centers that they're connected with. And even if you don't have the money to actually donate to some of these organizations, you can ask some businesses and institutions to provide us the PPE that we require. And I'll put all of this in the email and send them out a list of PPE, infrared thermometers, gloves, sanitation, goggles, healthcare suits, and so on that the doctor had mentioned. This question comes from Lee Davis in Texas. He says, why are they using formaldehyde for water purification, if that is the case? There have been rumors that people were putting formaldehyde into wells. Is it something you can speak to, Musaka?
Yeah, it's very rumor, but I mean, if you read on formaldehyde, I mean, whoever wants, first of all, it has been ruled out. The government has ruled it out through tests. But to be able to person from formaldehyde, that person must be very rich. You will have thousands and thousands of dollars of money to be able to provide enough formaldehyde to poison an entire world. And number two, if you ever know formaldehyde, it has a very irritating odor and scent. Odor, so one will pick it up quickly to be so, on the one hand, it has been proven to be true, and on the other hand, we have tried to educate people and say, well, if you just really bit of formaldehyde, you understand that it's something you can pick up by your nose, and the behavior is highly irritating. And, but that rumor has been ruled out. The test. I have a friend who works at this medical regulatory system. They done a test, and it's not true. It was just bringing it up. In fact, one of the places they said they had used formaldehyde, it has been shown that it was a real epicenter for Ebola. So those were just rumors that came about. And they were probably out now. They have done extensive investigation, and they have ruled that out. And just from practical reading, if you find the time, I would advise people to go and read on formaldehyde, the properties of formaldehyde, and you'll come to realize it's in huge quantity. And if it even got closer to you, you will be able to inhale it. So that's not true.
Okay. Thank you very much, Musaka. I really appreciate it. It's late in Liberia, and you took the time to speak to Liberians outside of Liberia. We appreciate it. Again, that's Dr. Musaka Fallah, who's doing the legwork in the fight against Ebola. He works in Montserrat for now, and he is a doctor in the fight against Ebola. We will be getting the doctor on the call from time to time to give us updates, and we will try as best as we can to organize such a call on a periodic basis, whatever that basis is, so that Liberians can call in and get updates on Ebola. So before we part, I want to give a couple minutes to each of the other organizations on the call to give us a recap or any comments they would want to make. So I'll call on Andrew Perkins from Beswa in Dallas. It's a nonprofit organization that does feeding programs in Liberia, and they've been in Liberia since 1998. They've been working to get supplies to Liberia, and if I'm not mistaken, I think Andy had mentioned that they do have containers either in port or in the process of being shipped to Liberia. So, Andy, can you recap for us just a couple minutes?
Thank you. I just want to say thank you for putting this all together, and we just want to work with the diaspora to help in any way possible. And I just do want to reiterate that we work in Grand Bassa, Riverside, and Nimba counties. Somebody had asked whether they could request that things go to a specific institution. We do that as much as possible, but basically within those three counties, we try to get the equipment, the medical equipment, to where it is needed most. And right now, they sort of need everything, but primarily personal protective equipment and the infrared thermometers and that sort of thing. And then we also ship food to Liberia, which is distributed to needy families in those counties. And we think that that's going to be something more needed in the near future. We're concerned about the situation for food in the country within the next few months. So we'll help in any way we can, and thank you for giving us this time.
Thank you, Andy. Thank you very much. And again, Andy's information will be included in the PDF that we're going to try to email out to those on the call. If you have email in the database, you can also email us with questions after the call, or if you need connections with anyone on the call, the email address is LIB, as in LIB towards Liberia, LIBSTOP Ebola@gmail.com, LIBstopEbola@gmail.com, and we will connect you with some of these relief agencies. If you have container or medical supplies or food, any humanitarian aid you want to send to Liberia, we can connect you with these humanitarian organizations. So, Scott, if you're on, you can go ahead. You got 2 minutes.
Yeah, Andy, I like how you phrase that, and it's for Global Health Ministries very similar as well in terms of, we ship to Long County and Lofa County, the Phoebe and Kern. That's been our traditional partners, but we've also been partnering with the Ministry of Health and want to support and empower them as they do their work throughout Liberia. We will continue to receive funds, receive donations. I give thanks to God for the support from the Liberian community. It's just been beautiful, and to see the funds, to see the fundraisers going on at churches and schools, people collecting hand sanitizer and gloves and masks and bringing it to us. I love that response and the ability for us to work together and to send these gifts over and pray that they will be received, pray that they will empower the staff and to protect them so they can go back. And we can hear reports that Ganta is online and Phoebe and Kern and the Catholic Hospital and Elwa and JFK and Redemption and all of these hospitals and health centers that we are back online and caring. And so for me, I just want to give thanks to God. I want to thank the Liberian community. Thank you for bringing together this call so that we can share. We can share ideas and collaborate and say who's got the best air freight option out there and how can we get product there then to Liberia. And I like how Samaritan's Purse, they are a leader in this and purchasing stuff and getting it out to those treatment centers. And so we want to continue that. And so if anyone has gloves and gowns and masks in the Twin Cities area, please consider donating those to Global Health. We will put them out in a third and fourth air freight shipment. I pray we can do that and pray that we can do another ocean freight container and get it there as quickly as possible, and pray that the Ministry of Health is able to continue doing what they're doing and to stop this virus. Thank you.
All right, thank you. Ladies and gentlemen, thank you again. My name is Philip Sua, and this effort was the effort of a lot of Liberian organizations here in the States and in Europe, and in terms of sharing the information and spreading the information to all of our Liberian organizations and institutions, both here and outside of the country. Again, this is not an individual effort on my part, so I can't take credit for it. I was actually given the task of moderating the call in a non-political setting, but the originators of this idea was Liberty Party. They originated the idea and have been doing some of the work to connect me with Liberian organizations like the Liberian Red Cross. Unfortunately, the caller had difficulties calling in. But I give them credit and as well for originating the idea, and I want to thank you for the call. I did have one last comment. I was told someone just sent an email that the Liberian Embassy is receiving merchandise or directing people as well, and I will include the embassy's website in the PDF that I will send out, and then you can access that information as you please. So once again, I want to thank you for attending the call. The email address for connections and discussions is libstop@gmail.com, libstop@gmail.com. Thank you and God bless.